Hi everyone, I'm going to talk about acne and the products that you could buy over the counter from a pharmacy or you can get prescribed by the doctor. The first thing that we tend to recommend for mild to moderate acne is a product called benzoyl peroxide. And benzoyl peroxide comes in lots of different brands and it comes in different strengths. So we always recommend to start with the lower strength, which is 2.5%. Okay, because it can bleach the skin. It can, it bleaches clothes a lot more, but it dries the skin rather than bleaches it. It can bleach the bedding, and it can irritate the skin if you start with a high dose. So we recommend that you start with 2.5%. You can work your way up to 5%, and then you can work your way up to the strongest percent, which is 10%. So benzoyl peroxide, you can buy that over the counter. You apply at night time just once, and it will help to reduce the inflammation and the scarring with acne. If that doesn't work, if it's not enough, you can get a course of treatment from the doctor, and this would also this is for mild to moderate acne. Mild to moderate acne. This would be a cream which would also have the benzoyl peroxide. So you could still have benzoyl peroxide in your cream, but you'd have an added ingredient to it. So you'd have the benzoyl peroxide, okay, but then you'd also have another agent called adapalene, okay. You could also be prescribed a product that has benzoyl peroxide as well, but it could also have an antibiotic with it. Okay, so we used to before give just antibiotics on its own for acne, but that's actually not recommended anymore. So benzoyl peroxide and clindamycin, which is an antibiotic. Okay. Another product that you could also get, and these are all creams, is again you could have the clindamycin, okay, which is, I keep putting E at the end, there's no E, which again is an antibiotic plus something called isotretinoin. And isotretinoin is what we call a derivative of vitamin A. And it works really well for acne. It's probably one of the strongest type of products that you can get for acne. The thing about isotretinoin, the most important thing, whether it's a cream or capsules, because you can get capsules, is that it's contraindicated, which means we cannot use it for somebody who is pregnant, okay. And what the doctor will do is that they will check, especially if it's oral capsules, because you can get that, they will check if the person is pregnant by doing a pregnancy test before they prescribe the isotretinoin capsules. They're probably, I'm not sure if they'll do it with the cream as much, but certainly with the capsule. And sometimes, and I've seen this on a prescription, when I get a prescription for isotretinoin capsules, the doctor will write on the prescription that the patient has confirmed negative for a pregnancy test, so that we know that that's okay, because isotretinoin is what we call teratogenic, which means it's harmful to the baby. Okay. So these products here, these creams, can be prescribed by the doctor. These are all prescription only medicines. This you can buy on its own from a pharmacy, and that's okay. And all of these are for 12 weeks. So we'd recommend that all of these creams is used for a 12-week course. Okay. So that's how we would treat mild to moderate acne in terms of the products. If the acne was worse, so if it was what we call moderate to severe, So moderate to severe, we would go for the creams again. So we can still recommend the same creams that we've got there, but we could also recommend a oral antibiotic with it as well. So it's still 12 weeks. Okay, so they still have the 12 weeks, but they could also have any of these creams here, plus an antibiotic such as lime cycline, okay, or another antibiotic called doxycycline, okay. So lime cycline and doxycycline are in the same antibiotic class. They are what we call tetracycline. And the most important thing about tetracycline is that, again, we cannot use it if somebody is pregnant or breastfeeding, because actually it can damage the teeth of the baby and the skeletal muscle, the skeletal system of the baby. So even children under 12 years old cannot take these because it can stain their teeth. Okay, it's not allowed. But we can prescribe it if the person is not pregnant. That's okay. We can recommend it, and it's pretty useful. It works really well for acne, particularly acne that is widespread. So when we say widespread, it's the face and the back as well, so other parts of the body. Doxycycline, one of the common side effects is that it can cause skin discoloration. I can't spell today. Discoloration. And it can actually make the skin turn kind of a blue-grey colour. So we would, one thing we would say is to try and use sun cream, because the sun can actually irritate the skin. It can cause sensitivity of the skin when somebody is on doxycycline. So, you know, that's what we would recommend, using sun cream, SPF. These two, because they fall into this tetracycline class, we would say as well to not have calcium containing products, so not to drink milk, for example, at the same time. And I've done a short video on milk and drugs, you know, common milk and drug interactions, because calcium can actually lower the effectiveness of these antibiotics. So we can just say, you know, keep it kind of 2 to 4 hours apart. And, you know, these can be prescribed for 12 weeks, which is about kind of 3 months treatment. So they're the kind of common treatments that we can recommend. They can go into further things. So if they didn't work, for example, we can think about more intensive medication, if you like, and we can recommend, and when I say we, it's the doctor really, or the prescribing pharmacist, but you can actually consider using contraceptives for the treatment of acne, and there are some that are licensed for the treatment of acne. So if you are prescribed this drug called Dianet, that is actually licensed. It can be prescribed for the treatment of acne, particularly severe acne, and particularly if none of these have worked. We don't like to give contraceptives straight away, because obviously we don't want to mess about with the menstrual period, but it can be useful if somebody does suffer from heavy periods. Then we can recommend contraceptives as a 2-in-1 bonus. And then the final thing, as I mentioned earlier on, is isotretinoin capsules. Okay, so again, isotretinoin, the main restriction is the pregnancy is contraindicated, but you can attend clinics now. So there are some pharmacists who run clinics for starting patients on isotretinoin, but I don't know if you've seen it in the news a few years back that it was associated with depression, mood changes, suicidal thoughts. It was the brand Roaccutane. So there is kind of a monitoring process with that as well. It's a very, very, very low risk, but it's something to be aware of. So hopefully that's given you a slight insight into the treatments that we often are involved with when we're thinking about the treatment of acne. If you like the video, please do like and subscribe. It would help with the algorithm if you like and subscribe my videos. Thank you.